I'm just starting the recording right now, so we can just go ahead and get going. But so I'm here with Amy. Amy, you got the Terahertz Wand. How long ago was it? 3 weeks?
I started using it July 10th, and today is August 4th, right?
Today's August 4th. Yeah. Okay. So
So,
you got the Terahertz Wand, and so. I know a little bit about your health issues, but you went through a whole host of various health issues. And so what were some of the primary things that you had going on that you wanted to use the wand for?
well, my entire skeleton was thrown off about 4 decades ago, 40 years ago. I tore my ACL in one leg. It was so painful I could not weight bear. And so I basically put all of my weight on the left side. And of course, you can't really stand like that. So I kicked my foot out like a bike stand,
Right.
which began more injuries, more knots, more joint damage. I ended up being bone on bone in my left hip. I herniated a disc. And by the time I left my house as an 18-year-old, I did have that torn ACL, herniated disc in my lumbar spine, and bone on bone in my hip. And then I went into a nursing career. And so, as you can imagine, my joints wore out. I never got the help that I needed to correct the muscular and skeletal imbalances. And so, after 40 years of that, I ended up in basically a giant knot,
Yeah.
mangled. And you'd never know because I am hypermobile. I have joints that are very floppy. And so, even a physical therapist could not see how badly I was compensating for the previous injuries I had sustained. And so even their exercises were making things worse and worse. So I have not slept well since I was a kid. And I've just had enormous amounts of indescribable pain. I mean, I don't know how, there are no words to say what that was like. Yeah.
Right. And I don't like to necessarily rank the pain, but on a 1 to 10, where would you say the pain was at?
Well, and it depends on the area of the body, because as you probably know, I did herniate 3 discs in my neck, and I had that half replaced, had 2 surgeries there. I've had my hips replaced, and while those were not being diagnosed and assessed, 7 years later, they were ground down so bad to a pulp that they couldn't believe I was walking. And so the soft tissue all around my hip joints, lumbar spine, that all spasmed and scarred up. And so I would have 8 out of 10 in some areas, 6 out of 10 in others, but
Right.
pretty much from my base of my skull down, 90% of my body is affected and with pain in some way.
Wow. So we talked, I sent you out at the time. I had some of these 500 watt wands that I sent one out to you. So can you talk about your experience that you've been using those now for the last, I guess, about 3.5 weeks or so? What's your experience been like, and how are you doing now that you've started using the Terahertz Wand?
So I can tell you, after my first use, let's pick 10 as an arbitrary number, so just to measure off of.
Okay.
The very first night, I went from a 10 to a 9.
Okay.
It was shocking. And I kind of I've damaged both shoulders, and so I can do an area for only so long, but then I have to switch because it's painful in my shoulder, and I'll hit my shoulder for a few seconds. And so I'm quite random about it all the time. I have to use some intuition. And so as I've gone, sometimes only around a knee and palms and maybe a little bit of my eyes. And sometimes, like I told you the other night, I did an hour and a half.
Yeah.
And then I drank a gallon of water. It took me 2 hours, but I did drink.
That's awesome.
Replenish.
The water is so important, and I don't want to get too sidetracked because I do have a tendency to do that. But I am reading a lot of information from a gentleman named Masaru Emoto, who basically said that your thoughts can control the molecular structure of water. He's actually proven it. And that Terahertz water, number one, it does a lot of benefits. There's a lot on that. I'm not going to go into that. But your thought process, if you put in the thought process of heal, thank you, I love you, water, you physically can change the molecular structure of water. I'm going to do a lot more on that. That's a subject right now I'm doing a lot of research on, but that is coming. But just the fact that you're drinking all that water, because after you get done using that terahertz, what's happening is, number one, the body needs to regenerate. It's going to regenerate, obviously, new cells. You need water to do that, but you're clearing out a lot of toxins. You're clearing out a lot of mutated cells and different things. And the water is so essential, number one, for rehydrating, but also for removing toxic material out of the body. So the next time you come through, you're not basically overbearing the body with more toxicity than it can get rid of at any one given time. So that's really, really good that you're being disciplined in doing that.
Yeah, thank you.
So
it's helping.
Yeah, so now it's been about 3.5 weeks now. There's certain parts of the body now that you're starting to see improvement on, now that you've started using it on more of a regular basis.
Yeah, and so the way I just found that I've had to do it is, when I first started, I just went for the more peripheral areas. And again, I'm just going to give the analogy of a giant knot. So I was working on some of the outside, most crucial parts, and the inflammation, I could tell, is just starting to, I think I even wrote you.
You did.
After a week, I think I said I was less jittery, because I have this kind of jittery, my movements are too fast and big. It's because I'm agitated all the time. I'm in pain all the time.
Yeah.
And so I move fast, I talk kind of fast, it's just jitteriness. Well, that started to go away or get reduced. So that was within a week. And so as I've kind of worked out the peripheral pieces, I'm moving in now toward my spine. Now, I don't think I said that my lumbar spine is entirely bone on bone, and I do everything I can to keep those areas limber. There's very little disc space, and so it's the pain, obviously, that's what keeps me awake most of the night.
Yeah.
I have been able to now get that unit down on my spine. Boy, I can sure tell a difference while I'm doing it. I have not hit a pain release threshold with that yet, but the fact that I'm able to get in there now and do my spine, that's saying something. I should say also, we are not supposed to shoot this at any metal or any composites that are in our body. I've had my neck half replaced, the lower half, both hips replaced, and I've had 5 knee surgeries. So I have metal that I have to be tricky with and work all around, especially with the scar tissue in my hips. And so just note to self, if anybody does have those replacements, I do have some tricks how to get around the metal. So we can go there at some point.
Okay, well, I definitely would like to get that information, because this is the exact reason why I like to do these calls, because as much as you might know about the product, it's people using it firsthand that are basically figuring out ways that it works for them, and little tricks like that. Because I do get that a lot. There's a lot of people out there that have had knee replacements, hip replacements, that have gone through various things. And so just having those little helpful tips is very, very helpful. And I do appreciate you bringing that up, because that is a common question. And I always answer it the same way, exactly the way you did. And that is, you don't point it directly on those areas, but you can go around those, and you can still get a beneficial result from, just stimulating and getting the wand and the frequency on the areas around it to help those additional areas.
Yeah. And so with the neck, it's a little bit tough, because I don't know where the metal is. So sometimes I'll just put the edge of the wand where it feels like they had put the metal, and let the light go right next to that metal on the soft tissue, if that makes sense.
Right.
And then on the hips, that is very, very tricky. So I just do my best, but there is a lot of scar tissue around the hips. And so I also can put my hand there and just work around. And when I feel the heat on my hand, then I just pull off a little bit.
Right.
Because it does straight through, I think, through bone and all that. It can go through to the hip.
Right. So, so we were talking last night briefly. Was there something also that you were saying about the melanin or the?
Oh yeah, I scraped a huge patch of skin off my left shoulder, and there is a lot of damage in my neck and left shoulder there. So I was just shooting the light kind of down toward that area where I can't really reach, right? It's, I don't know, I'd say between the shoulder blade and the spine. And so I was shooting the light down there to get to the muscle and the scar tissue. I think it was really just about 4 days ago. I looked at that white area and I thought, is that skin? I have new melanin in that white patch. It's almost the same color as my other rest of my skin.
Wow.
So this is shocking to me. I don't understand why it's doing that, but yeah, it's putting melanin back in my skin.
It's really amazing. I mean, it's just amazing what the body can do when it gets a little bit of assistance. So there's two things that I'll just summarize here, and then we can kind of finish up. But
Sure.
first of all, this Terahertz Wand is very, very well known now for assisting with a myriad of different skin-related issues. I've been using it with people that have psoriasis, obviously, wrinkles, appearance, acne. There's just so many different things. But now, you know, something like this is something new that I have not heard before. But with what I'm hearing about all these other things, it doesn't surprise me.
Yeah.
So,
I'm
and
impressed.
that's after 4 days. Now, the other thing I would say, and this
Oh,
would
no,
be,
that was after almost 3 weeks.
or 3
Sorry.
weeks, excuse me.
I noticed 4 days ago, yeah.
4 days ago, got it. And so then the other thing I would say is one thing also that you might consider is that you might consider trying to get the wand pointed onto your tailbone area, because when you get the wand pointed into the tailbone, it's going to help activate dormant stem cells. Yeah, and so when you get it on the wand on the tailbone, now recommended would be ballpark maybe about 10 minutes. And I will tell you what I do, and I don't know if this would help you or not, but I basically set the wand on a pillow. My couch is big enough so I can do it on the couch, but if I do, I can also do it on my bed. But what I do is I put the wand on a pillow, I turn it on, and then I just kind of curl up into a little ball and just get myself into that place where, because with the blower, obviously, it helps you know where it's actually hitting. And then I'll just let that thing run, and I can just lay on the couch watching TV or whatever I'm doing, and then just let it hit those areas of the back. Because it's as beneficial as that is, it can be a little tricky to get your arm back there to a point where you can actually reach your tailbone. So what I have found is that by just placing it on a pillow and laying sideways on the bed, I can use it that way, or on my couch, to really get to that area and not have to use my arms to do that. So with what we're saying, obviously, with all the areas of your back, you might find also that there's other parts of your back you can hit if you sort of situate it on a pillow and just kind of turn sideways.
I'm going to try that. That's really good advice.
Yeah.
I appreciate that. Yeah. Thank you.
So, well, thank you so much for sharing your story. I really appreciate that. Like I said, there's a lot of people that I talk to on a daily basis that have various types of issues. You've obviously got quite a few. And so, after a few weeks now, you're seeing a relief in the inflammation and the pain. And now you're starting to get into areas where it's starting to sort of unwind some of the muscles and some of the cramping, I guess, or what would be the best way to describe it?
I think I had a lot of scar tissue embedded in the fascia. I don't know how else to describe it, but I can tell you that I had an enormous amount of nerve pain because they were entrapped within rock hard muscles. In fact, I was going to tell you this too. When I used to try to dig into, say, muscles around my neck, it was like wood. I couldn't differentiate one muscle from another. I couldn't feel the muscle fibers. I was a rock hard knot. And so now I can feel some of the fibers. They're still very ropey, but at least I can get my fingers in there.
Wow.
And so I just think, and one pain clinic person was injecting something into that area, and he could feel the calcium granules from the damage to the muscles. And so I had fibrin and calcium and all kinds of stuff locked and trapped into my muscles. And whatever this wand is doing is breaking up that scar tissue. And I'm starting to have more mobility around my joints, and my muscles are getting longer instead of those short, spazzy, like people with cerebral palsy, you know how they're contractured all up?
Right.
I tiny, micro that. And so these micro contractures, or they're smaller contractures that you cannot see, those are opening up and allowing more movement and mobility to my joints and decreasing the pain and inflammation. It's just a powerful unit. I'm very thankful for it.
God, I'm super excited to hear that. And thank you so much for taking the time to go over this and talk about this, because, like I said, it's just very important. I think I've said it before, maybe not on this call, but, you can sit and talk about all the technology and all how it does this and it does that, and and it's all well and good, and certainly you want to know what you're getting, and obviously you want to know, have an idea what it's doing. But ultimately, when it really gets down to it, all people really want to know is, if I get this thing, will it help me? Does it help? Now, obviously, we don't make any claims that other people are going to get these results. This is not a medical device. It's a health and wellness device. As the disclaimer goes, we would just say also that never substitute the Terahertz Wand for going to get sound medical advice from a medical professional. However, it is a very useful device that will assist with many different things. So, this is one of many testimonials that I'm starting to put together. I've honestly had people ask me to say, hey, do you have testimonials? And I'm like, yeah, I got all these emails and I clumped them together. But, kind of what I was telling you last night, the emails are well and good, but it's a lot more, it has a lot more validity if you're hearing it directly from the person that's actually dealing with the pain and dealing with the discomfort and, whatever it is. So, once again, I greatly appreciate you taking the time out today to do this. And like with all the people that I work with, I'll look forward to talking to you again in another 30 days and 60 days and 90 days, 120 days, just following up with your progress. And, somewhere down the road, we'll definitely connect again, and we'll do another update to see how you're doing and see how everything's going for you.
Well, thank you, Sean. This has actually been a privilege, and I appreciate all your diligent care, your customer service, and having these personal phone calls on top of this amazing unit. I'm really thankful and blessed. So thank you.
Thank you, and I'm blessed as well. And God bless you, and I'll look forward to talking to you again soon.
Thank you so much, Sean.
Yes,
you as
ma'am.
well.
Thank you so much.
Take care.
Bye-bye.
Mm-hmm.